Health, they say, is wealth. With your health in place, anything can be achieved. Dr. Agnes is back in the studio to share more tips on how we can maintain a healthy lifestyle. It's good to see you in the studio again, Doc.
Thank you for having me.
Last time you came to the studio, we talked a lot about RSV and how we can enjoy our health, even the Christmas period, the festive period. Tell us, how has it been? I mean, what has been the feedback you've gotten so far with regards to that topic?
It's been amazing.
Right.
I mean, I received positive feedbacks from my colleagues, our community, viewers via Instagram, Facebook, and my friends and family texted me, and I'm just humbled, and I appreciate everyone for their support.
Right, and I feel this time we should be talking about BMI, something that is, has been out there, especially as it has to do with nutrition, exercise, and all of it. Tell us, what exactly is BMI and how can people measure and possibly interpret it?
So BMI stands for Body Mass Index. It's a measure of our weight compared to our height. Whatever metrics we want to use, for example, if we want to use kilograms or pounds to measure your weight, or centimeter or feet to measure your height, you just have to impute the values into a BMI calculator, which you can actually Google, and it will calculate your BMI for you. There are a few exceptions if someone is muscular, the level of fat may be lower than what their BMI predicts, or if someone is 60 years or older, their body fat usually increases and their muscle mass reduces. Yeah. Therefore, their BMI may not be an accurate reflection of their level of fat, which brings me to your second question about BMI, about interpretation.
Interpretation, correct.
So if your BMI is less than 18.5, you will be considered underweight. And if your BMI is between 18.5 to 24.9, that's the normal healthy BMI range. Yeah. And if your BMI is between 25 to 29.9, you will be considered overweight. Oh. And if your BMI is 30 and above, then you'll be considered obese. Also, there are subclasses in the obese category. Okay. Like if your BMI is between 30 to 34.9, then you will be in the class 1 obesity. Yes. And if your BMI is between 35 to 39.9, that's class 2 obesity. And if your BMI is above 40 and above, then that's class 3 obesity.
Right. So does this excess weight and obesity itself increase, the risk of severe illness in individuals, you think?
So obesity is a clinical condition where an individual has excess unhealthy fat and or distribution of fat. Hence, it comes with health implications. And there are several of them. I mean, if we have to start, for example, with our brain, it can predispose us to stroke, dementia, or even brain tumors. For heart, it can, because there's increased cholesterol and hypertension, it could predispose us to heart attack, which we medical professional would deem as myocardial infarction. And it can also cause angina, which is where we have pain coming from the heart due to narrowing of the heart vessels. For our breathing, we have what we call obstructive sleep apnea, where this is like a disturbed breathing pattern during sleep. For our tummy, we can have liver disease, we call fatty liver, gallbladder disease, indigestion, pancreatic conditions, diabetes mellitus, and it can predispose us to cancer, colon cancer in the women, breast cancer, ovarian cancer, fertility problems. It can predispose us to osteoarthritis, which is the breakdown of cartilage and bone within the joints. Right. That can predispose us to joint pains, and tends to reduce physical function and leading to poor quality of life. That can lead to depression and anxiety. And in general, it can lead to all causes of mortality, including death.
It's very interesting to know that the extent of damage, with obesity and overweight. But what role does the genes play in the whole of all of this? Because I mean, there are people who are typically they are born because this is the family thing. They are big and not they are making. So, what do you say to that?
So, one is likely to become obese if one parent or both parents are obese.
Right.
And this could be because we have over time learned like bad eating habits. And one can inherit the tendency in their genes that may cause them to be prone to overeating. And that sense of fullness may be faulty or not quite working as good as it should be when compared to others.
Right. So, we know that food and physical activities contribute to immensely to obesity and overweight. Beside these two I've mentioned, what are things and factors that does contribute to obesity and overweight?
So we've already mentioned like family history
Right.
and genetics.
Right.
We have medical conditions. For example, if one is depressed, some people, their appetite can increase for comfort food, and actually comfort food that is, high in salt, sugar, and fat, and that can predispose them to weight gain. Then we have other medical conditions like hypothyroidism, which is we have a gland which we call the thyroid gland that sits that is located in the neck, and is responsible it produces thyroid hormones, and these thyroid hormones help to regulate our body metabolism. So when the thyroid gland is not producing enough thyroid hormones, then our body metabolism is low, and that predisposes us to weight gain. We also have a condition called Cushing syndrome, where there's excess glucocorticoids, the steroid. So this happens when someone is taking steroid long term, and that can predispose the person to weight gain. Also, our body could be producing excess of the hormone called cortisol, which stimulates our appetite and cravings for food that is heavy in salt, sugar, and fat as well. And so in these conditions, yes. And also medications, for example, medications that we use to treat diabetes, insulin, contraceptive injections, medication that we use to treat for epilepsy, and antidepressants could predispose us to weight gain.
Right. So as we run towards the end of this year, we have clearly you can see we have very few days, and people are thinking of making right choices, lifestyles. What would be your advice to them?
Okay. In terms of advice, I will start with how is your eating pattern? For example, are you a fast eater or you are a slow eater? Because if you're a fast eater, there's a tendency that you consume more food.
Right.
That's equal to more calories, and that's equal to more weight gain. If the type of drink as well, for example, you can easily cut out lots of calories by making water your main drink, right? And we're now in the festive season. There's lots of, we all like comfort food, chocolate, ice cream, what have you. I would advise to eat less of the comfort food, and then you might want to try, opting for low calorie version of the comfort food. Likewise, you can increase your physical activity as well, because the body, when we are hungry, I'm talking about breakfast, lunch, dinner, that's the body signaling to us that they need calories. And the body needs these calories so that it can perform its life-sustaining function. Example of that is your breathing, blood circulation, and digestion. So when the body consumes all these calories for their vital function, guess where the rest of the calories goes to?
Where?
It's stored away for future use, and most of them as fat.
Right.
So if you're not exercising regularly, then you're only building upon your fat storage, and
Okay.
that's equal to weight gain. My advice would be that if your if your BMI is within the normal range,
Yeah.
then that person's focus should be maintaining that weight so that they don't go into the overweight category.
Right.
By regular physical activity, we recommend minimum, and I said minimum, of 150 minutes of regular physical activity every week.
Right.
This could be 30 minutes in one go or bouts of 10 minutes. And that could be brisk pace walking, jogging, swimming, dancing, whatever, regular activity that you prefer, as well as healthy eating. But if your BMI is within the overweight and obese category, then the focus will be weight loss.
Right.
So I would advise that we should prioritize our health every day.
Every day.
Okay, that's it. Prioritize every day, and you might use this opportunity to visit your family doctor regularly. For example, your family doctor can screen for underlying medical conditions that we've listed. Check your blood pressure, or the blood work that might include diabetes, cholesterol, liver function, thyroid function test, or kidney function.
Right.
So move more, eat healthy.
Good.
And implement healthy eating and exercising regularly. Make that your lifestyle now in order to prevent developing medical conditions associated with obesity in the future.
Make healthy lifestyle now, and I think it's a very good place to leave it, Doctor. Thank you so much for coming to the studio again.
Thank you for having me.
Right, and that was Dr. Agnes, a family physician here in Nova Scotia. For more updates on the activities in the community, if you have any event or activity you would like the community to know about, why don't you send us an email to communityupdateNS@gmail.com. Let's help you reach your audience even faster. Don't forget to subscribe to this channel and hit the notification bell. I am Promise Okoy, and I'll see you soon.